Today we're going to talk about 3 exercises that can help with hip arthritis. I can't tell you how many patients that come into our office and that's what they've been given as their diagnosis, or they think that that's where their pain's coming from, but they're not really sure. And we're going to talk about what that looks like and what to do. Now, one of the big things that we always have to rule out is the back. We're not going to be talking about that, but a lot of times the back can refer pain into the hip. And that can also create issues that can kind of mimic where you're feeling like maybe there's something wrong, maybe I have some hip arthritis, I can't fire my muscles correctly. But today we're going to talk about mostly the hip and what you can do and why it happens. So one of the big things that we look at is how does the hip move itself. And so we find a lot of people don't have good hip mobility. And we always say the first phase of physical therapy is mobility. How do the joints move? We look at the joints above the back. We look at the joints at the hip. We can even look at the joints at the knee because they all can kind of get affected. But we're just going to look at the hip joint itself. What happens as we get older is we tend to sit a lot more. We're always sitting, we're always bending, we're bending to clean. Maybe we like to cycle, so we're cycling, and so the hip's always in that bent position. And what happens is when that knee joint or that hip joint is bending kind of like this, the joint capsule gets tight. And then all of a sudden, you can't get the joint to go backwards at all. And that's a problem. And we've got to address that piece of it. And if you're bent forward like this slightly and that hip can't go back, it's going to elongate those glutes. Those glutes aren't going to be able to fire. And the glutes really help support everything. And then what happens is that the front part is you're using this so much, and you'll notice tightness through here, or you'll get tightness in the back. And a lot of times when you go and just take an image, as we get older, we're just going to show arthritis. But is arthritis really what's going on? Sometimes, yes. Now, we have had clients that we've done physical therapy, and about the 3rd or 4th visit, we're like, this is not a typical response. And yes, let's go and get some imaging because we think there might be some arthritis in the front part of that hip. But 9 times out of 10, we're noticing that we actually can help people. And we actually had someone this week that was the same way, that they had been told for years they have arthritis, they didn't want to have surgery. And even off the first visit that we worked with him, he started feeling better. So we're going to talk about a little bit about some of those techniques. So I'm going to have Victoria go ahead and lie on your stomach, and I'll show you kind of what we're talking about from a hip perspective. So a lot of times when we're looking at motion, we're looking at, does the hip move? And you'll notice that as I kind of hold down, like, wow, this hip doesn't move. Where this one, all this will be able to come way, way high. Well, that's a problem because you're not going to be able to recruit the muscles the way you need to recruit them. So the first phase of physical therapy is really looking at that mobility and improving that mobility. So what we're going to do is we're going to have go ahead and kneel, and we're going to have this leg straight back. And this leg's going to come in front, like you're going to kneel, and this foot's all the way in front. Nope, bring it, yeah, there you go. So it's going to be like a kneeling. So we do stuff like this all the time, and you're thinking, oh, I'm just going to stretch the front part of my hip. Yes, you feel that, but we're actually stretching the joint. This is what we want to do. We're going to show you a couple ways of doing it. The first way is you can just stand up here, kneel, and you're going as far forward as you possibly can. She has a lot of hip mobility, which is great, but most people don't. So you're going to go as far forward as you possibly can. Come back up. You can also get a band. And if you take a band, and you can tie a band like around a door or something, you want to put it really high up on the hip. And you can lean forward against the band. This is going to actually help mobilize that hip even more. So if you're noticing you're having a little bit of a harder time, this is going to give you some mobilizations in that hip, self-mobilization. So this is really trying to help us open up that hip. Now, there's other ways that we can do it, because sometimes if there's loss of rotation in the joint, there's other stretches we can do. But let's start out with doing this and seeing what happens. So we'll do that as the first exercise. And once when we get that mobility back, like it's now starting to move, because think about it, if you physically can't move, if my arm only can bend this far, well, this muscle is only going to be so strong because it works all the way through that muscle. Same thing, if you can't get that hip to move back, you're not going to get those glutes to fire. The glutes are a huge part of the hip and how it works and functions, because if you don't get those to fire, you're going to get something else to fire to compensate. And a lot of times it'll be to the outside, it'll be to the front because we're stuck like this a little bit, or we don't even realize that we're recruiting through here. People don't even realize, even if they're really young and they're an athlete and they're having some issues with their hip and they're having a hard time running or cycling, same kind of thing can happen. It's because they're always repeated going in that direction, and we've got to take our joints in the opposite direction to keep it more fluid and feeling good. So once we get that back, then here are 2 exercises that we can get to start getting those glutes to fire. What we're going to do is we're going to lie on our back. And the first exercise, you're going to just take a step. It's pretty easy. Feet up on the step. And we're going to go and squeeze our glutes and lift up as high as we possibly can. So squeeze those glutes and lift up and lift up. When you have a step, this is going to help activate those glutes more than those hamstrings. When your feet are down on the ground, you're going to feel the hamstrings a little bit more. Can you feel the glutes? Yes. Yep. And so I want you to hold that for a few seconds and then come back down. And what you're going to do is we're going to do this about 10, 15 times where you get the glutes to fire. This is kind of an individual activation, and we're going to do one that's going to be very functional where our feet are on the ground so we can get our glutes to fire. So this would be like the second exercise. First exercise, open up that hip joint. Second exercise, start working on getting those glutes to fire. So that's the first one. The next one we're going to do is we're going to actually do it in standing, and we're going to have a little bit of weights. You can do this without weights, but weights make it a little bit harder. And you're going to basically just hold the weights. They're going to come right down in front of us. And you're going to have one foot in front of the other, just kind of staggering those feet. And so most of the weight's going to be on the front leg. And you're going to take it and you're going to bend forward, hinging at the hip, not rounding the back. Hinge at the hip until you feel a good hamstring stretch. So she's hinging. When she feels that good hamstring stretch, what I want to do is you're going to push through the heel and squeeze the glutes to come up. So same thing, going forward, hinge at the hips, and as we hinge and we feel a stretch in the hamstring, push through the heel, squeeze the glute, and come up. This is going to get us to activate that glute without us having to like bend the knees. And sometimes the glutes are so weak, when we try to bend the knee, it hurts the knee because the glutes have to stabilize. Let's face it. I mean, if this is our leg bone, these are our muscles up in the hip, and they allow kind of rotation. And if those hips aren't firing, you're going to feel it in the knee. Keeping the knee straight, for the most part, it's not locked out, but just slightly bent. You're bending at the hip and squeezing through the glute is going to help the knee feel better if it bothers you, but it's going to help you really start activating the glutes while you are in a standing position, in a very functional position. And there's a lot of things that we can progress from there, but these are good exercises to get started. So again, my name is Stephanie. I'm with Empower Physical Therapy, and we help clients avoid surgery, injections, and medications, especially when people have had failed treatments time and time again. Those are the clients that we see every day in our office. So make sure you subscribe so that you can learn more as we put content out all the time.